Today, we're going to talk about an essential topic that could potentially save lives: the early warning signs of colon cancer. But before we continue, it is important to note that all the information presented in this video is supported by scientific evidence and has been verified, fact-checked, and reviewed by qualified health professionals to ensure impartiality and accuracy. Colon cancer, also known as colorectal cancer, is a serious condition that affects the colon and rectum. Detecting it early is crucial for successful treatment. Here are the top 10 early warning signs you should be aware of. Number 1. Persistent change in bowel habits. Persistent change in bowel habits is considered one of the early signs of colon cancer because it often indicates an alteration in the normal functioning of the gastrointestinal system, particularly the large intestine. The colon is responsible for absorbing water and electrolytes from the indigestible food remnants, compacting the waste, and forming stool before it is excreted from the body. When colon cancer develops, it can lead to various changes in bowel habits due to the tumor's location and its impact on the normal digestive process. A cancerous growth in the colon can partially or completely obstruct the passage of stool through the intestine. This obstruction can lead to changes in bowel movements, including alternating constipation and diarrhea or a feeling of incomplete evacuation. Number 2. Blood in the stool or rectal bleeding. Blood in the stool or rectal bleeding is another important early sign of colon cancer. It is medically known as hematuria or melena. The presence of blood in the stool can occur due to various reasons, and one of the significant causes is colorectal cancer. When colon cancer develops, the tumor may bleed due to damage to the blood vessels within or around it. The blood mixes with the stool as it moves through the colon, resulting in visible changes in the color and consistency of the stool. Number 3. Abdominal discomfort or pain. Abdominal discomfort or pain is another potential early sign of colon cancer. However, it is important to note that abdominal pain can have various causes, and experiencing this symptom alone does not automatically mean that someone has colon cancer. Many non-cancerous conditions can also lead to abdominal pain, such as gastrointestinal infections, indigestion, gas, and irritable bowel syndrome. When it comes to colon cancer, abdominal pain may occur due to several reasons related to the tumor's presence and its impact on the digestive system. As the tumor grows in the colon, it may partially or completely obstruct the passage of stool. This obstruction can cause abdominal discomfort or cramping as the colon tries to push the stool around the tumor. In advanced stages of colon cancer, the tumor can grow to the point of causing a hole in the colon. This can lead to severe abdominal pain and other signs of a medical emergency. Number 4. Unexplained weight loss. Unexplained weight loss is another potential early sign of colon cancer. When someone experiences weight loss without intentional changes in diet or exercise, it can be a concerning symptom that warrants medical attention. In the context of colon cancer, unexplained weight loss may occur due to several reasons. Cancerous tumors, including those in the colon, can alter the body's metabolism and increase energy expenditure. This can lead to unintentional weight loss as the body breaks down stored fat and muscle tissue to meet its energy demands. Colon cancer can cause changes in appetite, leading to a reduced desire to eat. This decrease in food intake can contribute to weight loss. Unexplained weight loss can occur in the early stages of colon cancer or as the disease progresses. Number 5. Fatigue or weakness. Fatigue or weakness is another possible early sign of colon cancer. Fatigue is a feeling of extreme tiredness or lack of energy that is not relieved by rest. Weakness refers to a decrease in physical strength or the ability to perform everyday activities. While fatigue and weakness can result from various factors, including lifestyle, stress, lack of sleep, or other medical conditions, they can also be associated with colon cancer. Colon cancer can interfere with nutrient absorption from the digestive system. This can lead to nutritional deficiencies, including vitamins and minerals, which may contribute to fatigue and weakness. As cancer progresses, it can affect various body systems, leading to fatigue and weakness as the body's resources are diverted to fight the disease. If you or someone you know is experiencing persistent fatigue, weakness, or any other concerning symptoms, consulting a healthcare professional is crucial for proper evaluation and diagnosis. Early detection and treatment of colon cancer can lead to better outcomes and an improved quality of life. Before we continue discussing the early warning signs of colon cancer, if you found this video informative, please give it a thumbs up and consider subscribing to our channel. Number 6. Anemia or low red blood cell count. Anemia can be one of the early signs of colon cancer due to the chronic bleeding that may occur as a result of the tumor's presence in the colon or rectum. Colon cancer, especially when located in the lower part of the colon or rectum, can cause slow and continuous bleeding that often goes unnoticed. When there is chronic bleeding from the tumor, it leads to a gradual loss of blood over time. The lost blood contains red blood cells that carry oxygen to various tissues and organs in the body. As the body continues to lose blood, it may not have enough time to produce an adequate number of new red blood cells to replace the ones that are lost. This leads to a condition called iron deficiency anemia, where there is a decreased number of healthy red blood cells and a lower amount of hemoglobin. Number 7. Narrow stools or pencil-thin stools. Narrow stools or pencil-thin stools can be a potential early sign of colon cancer. These changes in stool shape may occur due to the presence of a tumor in the colon that is causing partial obstruction or constriction of the stool's passage. However, it is essential to recognize that narrow stools can also be caused by various non-cancerous conditions, such as benign polyps, hemorrhoids, or inflammatory bowel disease. When colon cancer develops, the tumor can narrow the lumen of the colon, making it difficult for stool to pass through. As a result, the stool takes on a narrower, pencil-like shape as it squeezes through the narrowed area. If you experience narrow stools persistently or notice other concerning symptoms, it is crucial to consult a healthcare professional. A doctor can perform a thorough evaluation, which may include a physical examination, medical history review, and appropriate tests such as a colonoscopy to determine the cause of the symptoms and make an accurate diagnosis. Early detection and treatment of colon cancer can lead to better outcomes and improved prognosis. Number 8. Feeling of incomplete bowel movement. Feeling of incomplete bowel movement is another potential early sign of colon cancer. This symptom is characterized by a persistent sensation that there is still stool remaining in the rectum or lower colon after having a bowel movement. It can lead to discomfort and a constant urge to pass stool, even if little or no stool is expelled. Colon cancer can alter the normal contractions of the colon, affecting the movement of stool through the digestive system. This disruption in bowel motility can contribute to a feeling of incomplete bowel movement. Number 9. Constipation or diarrhea that lasts for more than a few days. Constipation or diarrhea that lasts for more than a few days can be potential early signs of colon cancer. These changes in bowel habits are significant because they often indicate an alteration in the normal functioning of the gastrointestinal system, particularly the large intestine. Constipation in the context of colon cancer, a tumor can partially obstruct the colon, leading to changes in bowel movements. The obstruction can cause the stool to become hard and dry, making it challenging to pass, which results in constipation. Diarrhea is defined as frequent, loose, and watery stools. In some cases of colon cancer, the tumor can cause an increased secretion of fluids into the colon, leading to diarrhea. Number 10. A family history of colon cancer or polyps. A family history of colon cancer or polyps is a significant risk factor for developing colon cancer. If you have a first-degree relative who has been diagnosed with colon cancer or precancerous polyps, your risk of developing the disease is higher than that of the general population. In some cases, certain genetic mutations can be inherited from parents and increase the likelihood of developing colon cancer. These mutations can be passed down from generation to generation and significantly elevate the risk of the disease. If you have a family history of colon cancer or polyps, it's crucial to be aware of the increased risk and take proactive steps to protect your health. Remember, early detection is key in the fight against colon cancer. If you have a first-degree relative with a history of the disease, consider discussing with your healthcare professional about starting colon cancer screenings at an earlier age. Regular screenings can make all the difference in catching the disease early when it's most treatable. Stay informed and share this information with your loved ones. Together, we can raise awareness about colon cancer and promote healthier lifestyles to reduce the risk. If you found this video helpful, don't forget to give it a thumbs up and subscribe to our channel for more informative content on health and wellness. We appreciate your support. Remember, taking care of your health is a journey, and we're here to accompany you every step of the way. Thanks again for watching, and we'll see you in our next video.